In this video, we would like to present you an arthroscopic repair of a Posterosuperior rotator cuff tear using a modified Mason-Allen suture technique with a transosseous equivalent construct. The MRI of the 63-year-old male patient reveals a large, repairable tear of the supra- and infraspinatus tendon with only minor fatty infiltration of the upper part of the infraspinatus muscle. The patient is placed in a beach chair position. The diagnostic arthroscopy shows an intact subscapularis tendon and a complete, retracted posterosuperior rotator cuff tear with an intact teres minor tendon. After debridement, the tendon can easily be reduced to the footprint at the greater tubercle. With the camera in the lateral portal, double-loaded all suture anchors are placed adjacent to the articular margin, and the sutures are subsequently retrieved through the anterolateral portal. Using a suture passer, the sutures are then passed in an articular dorsal direction through the tendon 10 to 12 mm medial to the lateral border of the torn cuff. While the white suture pair is placed centrally and slightly medially, the blue suture pair is split, with one limb being passed posteriorly and the other anteriorly from the central white suture pair. Depending on the tear size, multiple anchors are placed and the same stitch configuration is used for each anchor. To create a modified Mason-Allen stitch configuration, the posterior blue suture of each anchor is subsequently retrieved through the anterolateral portal. Using the suture passer turned upside down, the suture is then passed in a dorsal to articular direction, slightly anterior and lateral to the corresponding suture limb. Care should be taken to avoid damage to the cartilage of the humeral head when the needle passes through the tendon. The suture is then again retrieved from the articular side of the tendon through the anterolateral portal. Thereafter, it is passed in an articular dorsal direction, just medial and posterior to the point where it first passed through the tendon. In case of narrow anatomic conditions which complicate the use of a conventional suture passer, a curved suture passer can be used to pass a monofilament suture through the tendon at the place where the modified Mason-Allen stitch is desired. The anterior limb of the monofilament suture is then used to shuttle the posterior blue suture of the anchor, which creates an identical modified Mason-Allen stitch configuration. Each central suture pair is then tied in a horizontal mattress configuration, thereby bringing the tendon back to the footprint. To avoid tendon strangulation, the modified Mason-Allen stitches are not tied. To create a transosseous equivalent reconstruction, each horizontal mattress stitch is combined with a Mason-Allen stitch and brought 2 cm distal to the superolateral edge of the greater tubercle using knotless anchors. After tensioning of the sutures, we see a solid and watertight repair.